In this episode, we're discussing detox and how to do it safely. Thought leaders from Aware will weigh in on the importance of detoxing with support, alternative options, and the helpful role of medication-assisted therapies. This is the Well Aware Podcast.
Hi guys, welcome to the Well Aware Podcast. I'm Dr. Lauren Grawert, our Chief Medical Officer here at Aware Recovery Care. Today we have a really special episode that I'm excited about, focusing on detoxing safely. And today I'm also honored to be joined by two of my colleagues from Aware, Carrie Grassi, who is our Vice President of Health Integrated Service and a very experienced nurse practitioner, as well as Aiza Nimeh, our lead admissions psychiatric nurse practitioner. Thank you, ladies, so much for joining me today. Can we just start by sharing a little bit about yourself and your work as it relates to helping people begin their journey in recovery?
Sure. I'll go first. So yes, my name is Carrie Grassi. I'm the Vice President of Integrated Health Services at Aware. I've actually been with this company for almost 4 years now. I am a nurse practitioner by trade, certified in adult health, addiction, and correctional medicine. I actually spent a decade working in the correctional system prior to coming to Aware. So I was really lucky to be a part of some really progressive changes to how addiction was treated in those facilities over that course of time before starting here.
Wow, such a wealth of experience and different perspectives you have come from with addiction treatment. Aiza, tell us a little bit about yourself and what led you to addiction treatment.
What a pleasure to be here. I'm Aiza Nimeh. I'm a dual board certified psychiatric and family nurse practitioner. What brought me to substance use disorder is really the need for access to care in terms of addiction. We have seen a lot of issues specifically with the outpatient crisis of opioid epidemics. And when I saw that there's a big need for an access to care, I kind of like want to jump in and really explore this specialty in medicine.
Such a great answer. And, we know overdose is now the number one cause of death for Americans under the age of 40. So to your point, it's so needed, this treatment, and so underserved in general. We know that detoxing is the first step for many folks who begin their journey in recovery. And often it can be the most difficult and the most intimidating. So we know we really want to support both patients and their family through this difficult process. Kind of keeping that context in mind, Aiza, as a nurse practitioner, tell us a little bit about what the average client here at Aware can expect on a detox journey.
So initially, the client and the ally will meet with the nurse practitioner in the nurse. They're going to do what we call the initial virtual detox assessment. On this virtual detox assessment, we will actually conduct a process wherein we want to get to know the client in order for us to design a very seamless, great strategic treatment during this detoxification process.
That's great to hear. It sounds really organized and standardized. Carrie, can you talk to our listeners a little bit about why it's so important to detox with support?
Yeah, of course. So having support is really vital to ensure a safe and positive experience for the process. Many people will often try to go through detox on their own, but oftentimes they quickly realize it's not a good option. They might struggle with symptoms from withdrawal. They'll feel unwell. They might not be able to eat or drink properly. So having support from our team with the assessments and monitoring of their symptoms, determining if those symptoms are worsening, and us being able to provide guidance on how to take their prescribed medications to experience the least amount of symptoms is really the difference between a good experience and a bad experience.
So important. And I assume, when you're thinking about experiences, if people have negative experiences, they're less likely to try again. So every experience, I think, really affects people's overall success, with addiction treatment long-term. Carrie, can you talk a little bit more about the benefits of doing a virtual detox? Probably a lot of our listeners are unfamiliar with that, and talk to us a little bit about why it's an option, and how it might benefit folks who are thinking about starting a journey in recovery?
Yeah, that's a great question. So really, so many clients that I've assessed over time have explained to me that this truly was the best option for them for many different reasons. It could be privacy. It could be expectations or obligations that they have at home with childcare or maybe work obligations. Also, financial considerations with higher level of care being a bit expensive can be really prohibitive for many people.
Yeah, and I mean, if we could probably, the list could go on like minutes and minutes and minutes and minutes and minutes on the number of reasons why. I mean, you just probably, I think, scratched the surface there on all the reasons why virtual sometimes is a good option for people. Isa, one thing our listeners are probably thinking about is, how safe is virtual detox? Can you elaborate a little bit just on how our providers here at Aware help to maintain safety for clients throughout the detox process?
That's a great question, Dr. Grawert. So here at Aware Recovery Care, we have a thoughtful screening criteria and a thorough intake process to make sure that we will have a virtual outpatient detox that is safe and effective option for all clients who is suffering from alcohol use disorder or opiate use disorder. It also allows, as Carrie said, it allows the client to complete the acute physical withdrawal period from the comfort, convenience, and privacy of their home. Surprisingly, actually, only 10 to 12% of patient who has alcohol use disorder that will need an inpatient level of care during their detoxification process. Now, during our detoxification or virtual detox process here at Aware Recovery Care, we have nurses that will actually connect with the client and the ally to make sure that we do have a good progress of our detoxification. They will receive a support via text, via telehealth platform that is secured in order for us to maintain a safe detox process. Also, we advocate for clients to have an ally. An ally could be a family member, a friend that will really help the client improve or have a great outcome on the virtual detox. Now, as an ally could be a second narrator also that can advocate for the client, specifically when they're having challenging experience, physical experience from the detox process.
That's great. It sounds like, we really integrate lots of different levels of support here for clients and lots of different types of support. And having clinical support as well as non-clinical friend family support really, I think in many cases are equally important, for success for folks. Isa, tell us a little bit more about how medication can play a helpful role during treatment.
Yes, it does. It ensures a comfortable and safe detox process when you are with your medical provider and really looking into the best treatment or medication that can have a good outcome on a safe recovery process. And this will prevent, specifically for alcohol use disorder, this will prevent any type of what we call delirium tremens. This delirium tremens is potentially life-threatening, and we really wanted to prevent this. So when the client has medication, kind of like more like on the protocol side, this will actually give them more comfort.
Yeah, that's great to hear. And, I think a lot of folks think about detox as a temporary process, right? We know alcohol, it's about 5 to 7 days, opioid around 7 days. So some clients will go into that thinking, oh, this is very short term. I can get through this, no problem. I can, white fisted. But, the reality is that those symptoms for withdrawal for alcohol and opioid can be so debilitating and crippling and uncomfortable that the medication support for many people really can be vital, for sure. Speaking of medications, Carrie, any myths about medication-assisted treatment that you'd like to talk to folks about today?
Yeah, that's a great myth I would like to bust. So there's really so much stigma surrounding MATs and, how they're used and why they're used. And this is a big thing that we see with the families of clients too, right? So, you're taking my loved one off a medication and putting them on something else. You're just replacing one thing for another. That's something that we hear very often. And that's just not true. These medications that we're providing are, FDA approved, or they have a lot of evidence backing them, showing proof that they are helpful to clients, they're beneficial, they will help to decrease use, they'll help to protect the client if they did have a recurrence afterwards. All of these things are so important. So that's something that we really will have conversations with not just the client, but their family if they're involved as well, of the importance of these medications, and really trying to remove the stigma around the use of them.
Yeah,
Yes.
so true. Yeah, go ahead, Aiza, please jump in.
Yes. I just want to add another myth, and this is like number one myth that I always hear to the clients, even from the ally, about Suboxone. They always have this idea that Suboxone could be just a substitute for another addiction substance, and that we are not actually having a path to recovery because we are just putting on another substance, and this client could have another addiction to another substance. The fact is, addiction is defined as compulsive use of a drug or behavior despite of harm. Taking prescribed medication to manage a chronic illness does not meet definition of addiction. Taking a daily medication to maintain health is not a substance use disorder.
I couldn't have said it better myself. That was great. It's such a complex but important distinction that you just made. The other one that I'll throw in there too, I think medication myths, is that often clients will come to us afraid to start medication-assisted treatment because they're worried about their autonomy and their agency and their decision-making being taken away in that process. And sometimes that's, come from real experiences with other providers who've said, either you have to be on this medication forever, or the opposite extreme of you can only be on this medication for 7 days. And a lot of clients really have a lot of fear about not having a voice there. And so I think one of the things that's so important and different about us here is that we really, really want to integrate the patient and the client's voice and their thoughts and concerns and their decision making in the process when we're looking at how long they're going to stay on the medication, what dose they're going to be on. That really is, I think, one of our most important priorities. And hopefully we'll reassure patients that it's a shared decision making process, really with their voice being the most important.
Yes. I couldn't agree more.
Yeah.
Carrie, can you just talk a little bit more about kind of the general medical services that AWARE has developed to support a safe detox?
Yeah, sure. So, Aiza talked about the initial process of being admitted and what that looks like. But after that, so once you're in and you've been admitted to ambulatory detox, you're going to have daily check-ins with the nurses. And they're going to be doing assessments to make sure that the process is going well and safely, and that risk is still continuing to be low. There'll be oversight of experienced psychiatric nurse practitioners, so they can guide in the management of medication adjustments for the symptoms that the client might be experiencing. And they can also assist with management of co-occurring disorders and medication for that as well, which is really beneficial. We know that it's really important to manage the co-occurring disorders in addition to the addiction at the same time. So that's really beneficial that we have those providers that are able to do that. Also, the program's pretty flexible. It can be shorter or longer depending on the needs of the client. So, we might say to the client initially, this could be 3 to 5 days, or maybe it's going to be 5 to 7 days. But if the client's doing really well, we might be able to discharge them sooner. If they're not doing really well and we need to extend the medications or extend the service, that's something we're able to do as well. So it's not just a standard cookie cutter, it's all tailored to what the client needs. And I think also involvement of the allies is really unique for our program. And that can be really essential and can be one of the factors that creates success in the home during the detox process.
Absolutely. Well, guys, thank you so much for sharing your expertise with us today and taking the time out to discuss this really important topic. Before we go, do you have any final thoughts or takeaways that you want our listeners to be considering?
Yes, detoxing is the first step and perhaps the most challenging step to the road to recovery, but it is very essential for us to feel supported. Outpatient detox treatment provides a safe, supportive, and environment for clients to recover from physical dependencies associated with addiction. So this will be another option for our client in recovery.
Yep.
Perfect.
Absolutely. I echo the same.
We need, and with a disease that's the number one killer for folks now, we need as many paths as possible, right?
Yes,
As
yes,
many yellow
yes.
brick roads to the Emerald City, as I would say. Well, guys, thank you so much for joining us on the Well Aware podcast. I hope you found today's discussion to be helpful and illuminating. You can learn more about safe virtual detox on Aware's website, awarerecoverycare.com. Until next time, stay well and do something nice for yourself.